One of the best ways to detect breast cancer is through a mammogram. The screening tool can find cancer when it's at an early stage and often even before you can feel a lump. Today we're talking all things mammogram, and I'm happy to be sitting here with Dr. Christopher Czaplicki, who's going to break down how important this imaging tool is. So tell us about what exactly is a mammogram.
Sure, and thank you for having me.
Yeah.
So a mammogram is basically a low-dose X-ray of the breasts where we're looking specifically for early signs of breast cancer. The importance of mammography is simply that it saves lives.
When should a woman start getting her first mammogram? And if she has family history of breast cancer, should she go sooner?
The most common recommendation is that a woman starts at age 40. Now, if they do have a family history where, say, a mother or a sister has a history of breast cancer, the recommendation is that they start 10 years before that family member was diagnosed. So say mom was diagnosed with breast cancer at age 45, the woman would start at age 35.
So tell us about the mammogram process. I know it can be an intimidating, imaging procedure for some. So walk us through the entire process and tell us why women shouldn't be scared.
Of course. The actual imaging part takes about 15 minutes. For a typical woman, they will have 2 images per breast, so 4 total. There may be some additional if they have implants, things like that. A lot of women are afraid. They may have heard that mammograms are painful. I think it helps to know why we need to do compression. So breasts are basically just made of fat, and then the glandular tissue, milk ducts, milk globules, basically what forms the milk. So our goal is to sort of spread out that tissue and be able to see through it to see if there's any small cancers hiding within. Our mammography techs are specially trained for these images, so they'll help position the woman as best that they can. You know, some people have frozen shoulders, it might be a little more difficult, but all of our techs will work with you to kind of optimize the images and make sure that we can sort of get the most tissue to screen.
And so tell us about, from your position as a radiologist, what are you looking for once you get these images?
So the 2 main things that radiologists look for would be calcifications, which are bright white dots on the mammogram. They're very common, but that can be a sign of an early cancer if they're kind of clustered all together. And then the other thing would be a mass, which the mass is what we need the compression for to kind of spread out the normal tissue and see if there's anything hiding.
Why is it so important that a woman doesn't skip her mammogram screening?
Breast cancers are typically slow growing, so we don't want to image women too frequently where they're coming back every 6 months, but a year seems to kind of be the sweet spot where if you've had a mammogram and things look good, kind of waiting a full year, and when if we were to find something the following year, it would probably be something very small. When we start to wait 2 years, 3 years, they start to get quite a bit larger to the point where they may have spread to the lymph glands or even further. So we want to catch things when they're small and treatable. We're finding cancers that are pea-sized instead of waiting for a woman to feel the lump when they're golf ball sized or larger. So they improve outcomes. They're they can be a little bit uncomfortable, but the impact they make can't be understated.
Excellent advice. Thank you very much, Dr. Czaplicki, for the advice on the mammograms, and we hope that everyone gets their annual screening.
Thank you for having me.
Thanks.